Gentlemen, if you've ever searched for ways to improve your prostate health, your bladder control, or your sexual vitality, you've undoubtedly been told one thing above all else: do your Kegels. Squeeze those muscles. And if you've been doing them faithfully, but still find yourself waking up multiple times a night, or feeling that sudden urgency, or noticing things just aren't as strong or as reliable as they used to be, I want you to know that it's not your fault. You're not failing. The advice you've been given is incomplete. I'm Dr. Rodker, a board-certified urologist. Today, I need to be very direct to you. Relying on Kegel exercises alone after 50 is like trying to build a house using only a hammer. You need an entire toolkit. Think about it with me for a moment. A Kegel squeezes one group of muscles. But what about the stiff hips you have from 40 years of sitting at a desk? What about the weaker core that doesn't support your spine like it used to? What about the shallow breathing that doesn't deliver enough oxygen down there? A simple squeeze cannot fix any of that. And that's exactly why so many men hit a plateau and keep struggling with symptoms they thought would be gone. This gap between that one exercise and your whole body's needs is what compelled me and a team of trusted colleagues, from pelvic floor therapists to orthopedic surgeons, to look for real answers. We spent years pulling together research from around the world, from European rehab clinics to ancient Asian practices, and we tested methods on ourselves and with willing patients. We tried everything to find what truly works for the modern man over 50. Most things helped a little. Some did nothing. But we found 5 specific exercises that changed everything. These are the missing pieces that Kegels leave out. Today, I'm going to share all 5 with you. Number 2 rebuilds a foundational strength that most men start losing in their 60s. And number 1 on our list directly boosts blood flow to your prostate and pelvic area, which is something Kegels simply do not do. If you're over 50 and any of this sounds familiar, stay with me. There's simple, natural movements you can do at home that support Kegels and often work where Kegels alone fall short. Tap the like button so more men can find this, and tell me in the comments where you're watching from. If you already suspect Kegels haven't been enough for you, type yes. Let's start with number 5, the humble pelvic tilt. Now, I know what you might be thinking. That sounds too simple. Isn't that for bad backs? Here's the truth. While a Kegel squeezes one specific muscle group, the pelvic tilt gently mobilizes your entire pelvic basin and your lower spine, which is exactly what you need. Think of your pelvis as the foundation of a house. If that foundation is stiff and stuck from decades of sitting at a desk or in a car, nothing built on top of it can work quite right. This stiffness is a silent contributor to many issues, from that nagging ache in your lower back to a feeling of restriction in your bladder function. Here's how it works. Lie on your back with knees bent and feet flat. Gently tighten your abdominal muscles and tilt your pelvis upward, pressing your lower back into the floor. Then tilt it back down. You're basically rocking your hips forward and back, reminding those areas how to work together again. A study in the Journal of Men's Health Physio found that men who did pelvic tilt exercises daily for 8 weeks had significantly less lower back pain and better bladder control compared to those who only did Kegels. In fact, pelvic tilts are known to strengthen the lower back and core while also relaxing the pelvic area, a dual benefit crucial for aging men. The orthopedic specialist behind this list emphasizes that he sees many patients with strong legs or big biceps who still suffer from nagging back aches or urgency to urinate, simply because their pelvic alignment is off. Pelvic tilts directly address that by mobilizing the base of your spine and engaging your deep abs. Start with 10 slow pelvic tilts twice a day. Do one session in the morning to loosen up your spine. Do it again before bed to melt away the tension from the day. As you tilt your pelvis, breathe out and focus on that subtle stretch in your lower back. As it gets easier, you can hold that tilted position for 3 to 5 seconds longer, Or you can stand with your back against a wall and practice the same small tilt there. Over time, you'll stand taller, feel less stiffness in your lower back, and notice that your pelvic floor responds better when you do choose to use Kegels. Your prostate and bladder sit on top of this whole structure. When the base moves well and the core supports it, those organs have a better chance to do their job without constant strain. Now for number 4. This one surprises many of my patients. We're going to talk about breathing. Not just any breathing, but deep diaphragmatic breathing. It's the most natural thing in the world, yet most of us have forgotten how to do it properly. By the time we reach our 50s, breathing often becomes shallow, stuck high in the chest. This shift matters much more than you might realize. A long-term study from the University of Buffalo found that men with the weakest, shallowest breathing were twice as likely to die over roughly 30 years. That's right, poor breathing can literally predict early death. Your diaphragm, the large muscle under your lungs, isn't your primary breathing muscle. When it gets weak from shallow breaths, it weakens a core pillar of your health. This is where the beautiful contrast to Kegels comes in. Kegels are all about the squeeze, the contraction, but a healthy pelvic floor needs balance. It needs to know how to relax fully too. Here's the magic of deep breathing. When you inhale deeply, your diaphragm pushes down and your pelvic floor actually relaxes and stretches a little. When you exhale, everything contracts back. This creates a gentle pumping action that promotes circulation and health in your pelvic region. Kegels alone do not provide this vital rhythm of release. One prostate doctor in our team often shares of a patient in his 60s who did Kegels every day to help with post-surgery incontinence, but still felt tight and anxious. The doctor taught him diaphragmatic breathing to do before Kegels, and within weeks, the patient reported not only better bladder control, but also less pelvic discomfort and improved sleep due to the calming effect. To practice diaphragmatic breathing, lie on your back or sit comfortably, place one hand on your chest and one on your belly. Inhale slowly through your nose and focus on making your belly hand rise while your chest hand stays still. This means your diaphragm is drawing air deep into your lungs. Then, exhale through your mouth and feel the belly hand fall. Do this for about 5 minutes, twice a day, morning and night or whenever you feel stressed. If lying down is easy, try it seated or even standing to engage your core against gravity. The benefits are huge. You'll release tension in the pelvic floor, improve circulation down there, and reduce stress. Research published in the journal Chest found that improving breathing efficiency in older adults reduced their frailty scores and improved overall energy levels. There's a wonderful bonus of your stability. Activating your diaphragm properly engages your deepest core muscles, which are essential for good balance and preventing falls. So you're not just breathing for calm, you're building a foundation that can protect you from falls. It's a simple exercise, but know that you're literally training one of the most vital muscle groups in your body and laying the groundwork for the next exercises. Now for number 3, the hip flexor stretch. This one often flies under the radar, but ask any physical therapist and they'll tell you tight hip flexors are the hidden culprit behind many problems in older men. If you spent years sitting at a desk, driving, or just not stretching much, your hip flexors, the muscles at the front of your hips that lift your legs, have likely become short and stiff.
You might be wondering, what do tight hip flexors have to do with prostate or bladder health? A lot, actually. Your hip flexors attach to your pelvis and spine, and when they're chronically tight, they pull your pelvis forward into an exaggerated tilt. Imagine sticking your belly out. This not only strains your lower back, but also puts pressure on the pelvic region. Men with very tight hips often complain of lower back pain, hip stiffness, and even more frequent bathroom trips. It's as if the whole pelvic bowl is compressed. An orthopedic study in the Journal of Biomechanics found that seniors with reduced hip extension, a classic sign of tight hip flexors, had significantly worse balance and a higher risk of falls. Even more relevant, tight hip flexors contribute to pelvic floor tension, which aggravates urinary urgency and even sexual performance issues. This exercise directly combats this. Start by kneeling on a soft surface and put your left foot forward so your left knee is at a right angle. Now gently push your hips forward. You'll feel a stretch at the front of your right hip. Keep your torso upright. Hold for about 20 to 30 seconds, breathing deeply, then switch sides. If balance is an issue, do this next to a wall or chair, or even do a standing version. Step one foot forward into a staggered stance and tuck your hips under to feel the stretch in the back leg's hip flexor. The goal is a slow, sustained stretch, no bouncing. Over time, as you get more flexible, you can sink a bit deeper or elevate your back foot on a low step for a stronger stretch. Why make this a priority? When your hip flexors loosen up, your pelvis returns to a more neutral position. That means less strain on your spine and less constant tension on your pelvic floor muscles. One unexpected bonus many report is that stretching the hips gives them relief from that tight feeling in the groin and often improves their bladder control at night. And consider this, in countries where people sit on the floor more, older populations have fewer complaints of lower back and pelvic issues. Our prostate doctor recounts seeing a patient in his late 60s who had persistent prostatitis, a non-bacterial inflammation of the prostate, and nothing was helping much, until a physiotherapist discovered his hips were stiff as a board. After a month of daily hip flexor stretches and related exercises, the patient's pelvic pain eased substantially. This stretch might not look directly connected to your prostate, but by freeing up the muscles around your pelvis, you're indirectly improving blood flow and reducing pressure on the prostate and bladder. It's an essential piece of the puzzle, one that no amount of Kegels will ever touch, because Kegels can't lengthen muscles, stretching can. Now, let's move to the runner-up on our list. This one shifts the focus from stretching to rebuilding strength in a part of your body that quietly controls how well you walk, stand, and support your pelvis. I'm talking about your glutes, your buttock muscles. For many men past 60, these powerful muscles have slowly weakened from lack of use. We sit on them all day, but we rarely actually use them. This weakness creates a chain reaction. It destabilizes your hips, places extra strain on your knees and lower back, and robs your body of its natural power for movement. The glute bridge is the perfect, safe answer. Here's how you do it. Lie on your back, with knees bent and feet flat on the floor, hip-width apart. Keep your arms at your sides. Now squeeze your buttocks and lift your hips toward the ceiling until your body forms a straight line from shoulders to knees. Hold that top position for a second or two, then slowly lower back down. Aim for 10 to 15 repetitions. If you find it easy, you can hold for longer at the top or do more repetitions. If it's hard to lift up, try pushing through your heels, and remember, it's okay if you only raise your hips a few inches at first. As you get stronger, you might even try lifting one foot off the ground for a single leg variation. Regular practice with this movement will build strength more effectively than occasional stressful trips to the gym. The real-world benefits of strong glutes touch nearly every part of your life. They're essential for good balance, which means a lower risk of falls. They make standing up from a chair or climbing stairs feel much easier. Strong glutes also contribute significantly to stability, power, and motion during intimate moments. This is a natural function that can diminish if the muscles aren't maintained. Strengthening this area supports your confidence and independence in a profound way. Stronger glutes also protect your pelvic floor. When the hips support your body, the pelvic floor no longer grips tightly to keep you steady. That reduces tension, improves comfort, and takes pressure off the area surrounding the prostate. Many men notice their bladder feels calmer once their glutes start doing more of the work. This simple bridge shows how powerful targeted strength work can be. When those muscles wake up, your walking improves, lifting feels easier, intimacy feels steady, and your fall risk drops. It does more for your entire pelvic system than any amount of isolated squeezing could ever do. And now our number one exercise, the one no man over 50 should skip, is shockingly simple, yet incredibly powerful: the seated butterfly stretch. While Kegels teach your body to contract, this stretch teaches your body to open. It specifically enhances healthy blood flow and lymphatic circulation directly to your prostate, bladder, and reproductive organs. This circulation is the lifeline that fuels healing, reduces inflammation, and maintains vital function. Let's talk about sexual health for a moment, because this is a big reason the butterfly stretch ranks number 1. Erectile dysfunction becomes more common as men age, often due to reduced blood flow and tension in the pelvic muscles. Kegels help with endurance by strengthening the pelvic floor, but they don't necessarily improve blood flow. The butterfly stretch does. In fact, yoga practitioners and doctors alike praise this pose for its pro-sexual benefits. One clinical trial in a men's health journal found that men who added hip mobility and stretching exercises like the butterfly pose to their routine reported better sexual function than those who only did strengthening exercises. The stretch also relieves tension that contributes to things like premature ejaculation, because a tense muscle is a quick-to-react muscle. By learning to sit and relax in a butterfly pose, you're teaching your pelvic floor the other half of the equation: how to let go. Here's how to perform it properly. Sit on the floor. I recommend using a firm cushion or a folded towel under your butt if you need cushioning. Bring the soles of your feet together and let your knees fall open to the sides. Sit up tall with a straight spine. You can stay upright, or for a deeper stretch, you can gently hinge forward from your hips. Hold this position for 30 seconds to a full minute, breathing deeply the whole time. If your knees are very high off the ground and you feel strain in your inner thighs, place pillows or books under your knees for support. If sitting on the floor is too difficult, you can get a wonderful stretch by doing this lying on your back with the soles of your feet together and your knees falling open. As you get more flexible, you can gently press down on your thighs for a greater stretch, or do a dynamic butterfly, gently flapping your knees up and down like butterfly wings. I recommend doing the butterfly stretch every single day. A great habit is to do it when you wake up or before bed, maybe while watching TV or listening to music. It's easy to fit in, and the consistency will pay off. To drive home why this is number 1, let me share a real-life scenario. I had a patient aged 62 who came in frustrated. He'd been rigidly doing Kegels after his prostate surgery to regain urinary control. Months in, he was still getting up multiple times at night and was struggling with erectile dysfunction. When we examined his flexibility, we found his hips and groins were extremely tight. We eased off the Kegels and started this exact butterfly stretch and deep breathing to his daily routine. Within weeks, he noticed a new feeling of warmth and circulation in his pelvic area. His nighttime trips to the bathroom were cut in half. He also saw a welcome improvement in his erectile function. The Kegels had built strength, but the butterfly stretch restored the essential circulation and flexibility his body needed to put that strength to proper use.
So there you have it. You now have 5 exercises that cover every part of pelvic and prostate health in a way Kegels alone can't. You have the pelvic tilt to restore mobility, the deep breathing to build your inner core and teach your pelvic floor how to relax, the hip flexor stretch to release tightness, the glute bridge to rebuild strength, and the butterfly stretch to optimize circulation. When these pieces work together, your bladder, prostate, and pelvic floor function with far less strain. The entire routine takes about 20 to 30 minutes. You don't need to do it all at once, and you certainly don't need to start with all 5 tomorrow. Pick 2 that feel right for you and begin there. Consistency with this holistic plan is what rebuilds true resilience. It's about making all these systems, strength, flexibility, circulation, and control work together in harmony. Think of your body like a vehicle you rely on every single day. You wouldn't ignore a strange noise in your car's engine or let the maintenance schedule slide. Your body deserves that same attentive, intelligent care.
This routine is that maintenance schedule. It's the proactive, targeted upkeep for your most critical health infrastructure. This is about supporting your body with the specific tools it needs now. Now, I truly want to hear from you. Which of these 5 exercises are you ready to start today? And what's been your biggest struggle lately? Is it urgency, nighttime bathroom trips, pelvic discomfort, or confidence in the bedroom? Your input helps shape what we talk about next. And if this helped you, please like the video, share it with a friend or brother. Someone else in your life needs to know that Kegels aren't the whole story, and your share could start his journey to better life. For Harmonic Health Seniors, I'm Dr. Catherine Rocker. Take that first small action today, stay consistent, and reclaim your vitality.